Walking pneumonia surge. How to identify and manage symptoms. The U.S. Centers for Disease Control issued a warning on Friday, October 18, due to the rapid increase in pediatric cases of atypical pneumonia, sometimes referred to as walking pneumonia, a lung illness caused by the bacteria Mycoplasma pneumoniae. Atypical pneumonia is the medical word for a kind of pneumonia that is commonly referred to as walking pneumonia. That simply indicates that the patients don't follow the sort of typical course of fever, cough, and acute worsening, said pediatric emergency medicine specialist Dr. Matthew Isaac Harris, the medical director for critical care transport at Northwell Health in New York. They appear clinically better than the typical case, he says, adding that a delayed diagnosis may result from these milder symptoms. Their cough may get worse over a week or two. It can occasionally be a fever, according to Dr. Harris. They do not exhibit the typical 3 to 4 days of elevated fever and productive cough associated with more traditional pneumonia. Although the number of incidents is increasing, the doctor notes that this isn't a unique year. Every couple of years, we experience these outbreaks of Mycoplasma pneumonia. They cough all the time in small classrooms, in nursery school or playgroups, he says, explaining why it's spreading among kids. The exposure to other children who cough all the time around them is what puts children in more danger. This year's spike occurs every couple of years, he clarified. It is very contagious. The good news is that it's very, very treatable with antibiotics, namely azithromycin, which he clarified is more colloquially known as the Z-Pack, Dr. Harris says. This is not the time you're going to have to struggle with your kid 3 times a day trying to get in a large volume of antibiotics because it's once a day for 5 days, he says. Additionally, it's critically important to complete the whole course, regardless of how rapidly your child heals. Dr. Harris does, however, caution parents against using over-the-counter cough remedies. Children have a high tolerance for honey. A natural remedy for coughing is honey. I would advise parents not to give their kids cough medicine unless their pediatrician has given the all-clear. Despite the CDC's warning, Dr. Harris states we're in the stage of be mindful. Keep an eye out for symptoms of respiratory distress, which is particularly concerning for young children under 2. Older children will inform you that they are not feeling well, breathing faster, not drinking as much, maybe not peeing as much because they're not drinking, he told parents, were some indications to look out for. The doctor states, we do not want parents to rush to the pediatrician every time their child coughs. It is just that cough that's slowly worsening and having low-grade fevers after a week to 10 days. Not getting better, that's the time to see your pediatrician.